I'm Sam Crowe, I'm the Assistant Director of Public Health for Bournemouth Borough Council, and I'm here to talk about two small projects which we hope show how public health is helping to build a better Bournemouth. The first one is about smoking cessation, and smoking is still the largest cause of preventable death, particularly here in Bournemouth. What we realised a couple of years ago from talking to people who provided the smoking cessation service was that it really wasn't reaching people in Boxcombe.
One of the projects we're working on at the moment is a pilot called the Community Health Champions, and it's based in Boxcombe and Springbourne area. We've based it in these areas because we know there are more people smoking in these areas and not actually accessing the services to help them give up. So what we've done is trained a number of volunteers who've managed to give up smoking, and they're working with people to help them to improve their health and give up smoking as well. We've chosen to use volunteers for this project because we know that people can encounter a number of barriers trying to access traditional health services, and often people find it easier to hear from their peers their experiences, and it can help to break down the barriers and help them access services if they already know someone who's used that service and had a positive experience and achieved the outcome they were looking for.
Hi, I'm Reese, and I'm one of the Community Health Champion volunteers. I've attended a couple of events so far. I've been at the Sovereign Centre and the stoptober event. I've talked to friends and family and those at the pub because as an ex-smoker, I do believe I can help people give up smoking.
Once that person that they're working with is ready to make a change, they might then refer them into services that can help them. And because they know that person and they've got that relationship with them, they're able to support them on their journey to give up smoking.
So the second project is about mental health, and what we did was it started with a conversation with one of the community wardens who said that in the course of her work for the council she comes across a lot of people in the community suffering from common mental health conditions. So what we did was we partnered with Health Education England, and we arranged training for staff right across the council, so staff, managers and members, on a course called Mental Health First Aid. It's exactly that. It's very simple first aid to people who might be suffering from a common mental health condition. So I'm really pleased that you're going to hear about just how public health is helping to build a better Bournemouth.
One of the initiatives we've been working on this year has been to provide mental health first aid training in conjunction with Health Education Wessex to the borough staff. We've trained about 150 staff in Mental Health First Aid Light, which is an introductory and awareness raising course. And we've seen members of staff from management and strategic levels right through to front-facing operatives. The reason behind the training is to obviously upskill the workforce and give them a greater understanding in mental health awareness and to reduce discrimination and stereotyping and stigmatisation. And that's already seen some great benefits, and we've had a number of really positive feedback stories from different staff teams and members around the benefits it's provided to them, helping to reduce stress levels and working arrangements within the teams in various environments, but also with the staff going out to meet the customers and clients in their own homes, helping them to reduce crisis situations and get appropriate help, and also to find novel and innovative ways of working with the residents in some of their housing situations to enable them to stay safe and to enable the work that has to be done to be accomplished.